Good afternoon, everybody. First of all, I would like to thank uh, the WBPDCL authority to invite me to deliver a short speech on the AI for healthcare. So my position is a little bit uh, confusing because essentially for last 35 years I am working on semiconductor technology. So neither I am an AI expert nor I am a health specialist, but I am finding many of the gatherings here. They are the stalwarts in AI, and also we have seen Dr. Kunal Sarkar. So I was feeling that in front of them, just I am trying to do something which may be addressable for this the crying need of our society, having some social impact. So I made these slides primarily taking care of our own students, the new generations. So although it is AI for healthcare, but one thing that comes to my mind that any research, especially in our country, especially those are the institutes are responsible for national service, there should be one motto in mind that at least some product or innovations should come out from there. And so I am saying translational research in this. So, okay, lot of papers, lot of patents, lot of deliberations may be outcome of your research, but whether something which will cater to the need of the society has a different kind of I think, achievements. I will actually focus on this. In a lighter note, that I was present in this AI Impact Summit, and this was the presentation. This particular innovation was presented there. And IIT Kharagpur have a stall, and IIT Bombay and other IITs. And in front of us, also the famous university, who is becoming pretty famous, of Orion. All of you know about that. And it was always jumping, twisting, and etc. So I was just tweeting my student that nobody is coming to our stall. Everybody is going to this jumping dog is attracting all my crowds. So actually, later on, you know that. Don't take in a different way. We can also do something. We can also develop. And so always looking at abroad to do something is not usually true. Of course, get the knowledge from them, but try to develop in India. And second point, what I understand, the gist of the AI innovations, the summit impact, that India is going to develop a base for manufacturing. Okay, then we know that our people here, they have certain knowledge gap and the skill gap. And now, if you want to have a different chain of business channel and trade, China is the big, already they are much, much bigger than that. But if you want to go to that level within, say, next 10 years' time, and then probably the gap can be reduced by utilizing the AI. And that is exactly why AI is becoming so important, and so why 20 countries actually came in this AI summit, and a lot of billions of dollars you have seen will be invested in our country. This to reduce the gap. And AI-enabled technology, where probably our people, our students, our manpower will be accelerated learning stage and take the advantage of AI, so that finally India will become one of the most powerful nations, especially in manufacturing technology. So that is the essence which I have felt in participating in this AI summit. So that is the today's topic, since it is the health issue. So it's breath analyzer I will talk about, and I will not restrict it to breath analyzer. Something you can feel like some Alexa kind of idea, and where if you just take your Excel the breath. So from that breath, how you can detect various diseases, early detections. And the whole idea is to make the device affordable so that you can actually keep it in your home. So like thermometer or pressure gauge, there will be some kind of I will show you my product ultimate shape of that. And the cost will be such that it will be affordable. So where there is I would say that what consists of our breath, 78% is nitrogen, and 16 and nearly carbon dioxide is 4.4%, and other gases, oxygen 16.4%. And there is a minuscule amount of the VOC, volatile organic compounds, like say acetone, like say aldehyde, and etc. So there are many such VOCs that is coming along with those main components. Our detection technique is to detect those VOCs, and there is a universal WHO published work, and I will show you that immediately, that traces of those VOCs can indicate the metabolic, any kind of metabolic disorder, or diseases like chronic kidney disease, or say lung cancer, and diabetic, and so on. And there are 27 such diseases has been enlisted. But here we are trying with only 4 diseases we have targeted. Otherwise, the platform will be too big, and the training cycle will be too big, so that gradually we will add on the value of our products, increasing more and more disease predictions. And this is the targeted organs, and where some malfunction of them, actually, for example, the kidney. If the kidney starts not functioning well, then the toxin that creates actually goes through our blood, and then comes down to the actually to the lungs, and to the alveoli there is a diffusions of gas, and that is particularly for kidney disease. You will get the ammonia. So NH3 will come out, and that percentage from a normal healthy person will be more than that. So it is not thresholding, but some kind of a range you can predict. And that is already given in the literature, and also WHO supports those data. So this is the kind of, I targeted 4 diseases: lung cancer and chronic liver disease, chronic kidney, and diabetic. So if you look at that example, that ammonia percentage for chronic kidney disease, you find it that typically the order is 842 ppb, whereas the concentration will go up to 2000 more than, and you can think of that you have the possibility of your kidney is not functioning healthy, because comparisons of that. So what is the challenge of the sensing? That you have to detect that VOCs, which is trace element in nature. So sensitivity is the issue. So typical sensitivity, if you look at the this kind of a sensing, that is around 50 ppb to 5 ppb, like that, parts per billion. So it requires a holistic innovations from the device to the decision making. Okay, so what we have done, we have used our device. So our device is basically a FET device. I will go into that. Everybody knows about transistors, which is used for amplifiers. What we have done, that I made a paradigm shift from the typical the conventional way of resistive sensing. We have gone into the active sensing. What we have done, that when that VOCs are actually impedance on the open channel, then it modulates the current and is amplified by the amplifier transconductance and the output impedance. There is intrinsic gain of the amplifier, which amplified the signals. That's why I get better LOD, which can lead up to 50 ppb kind of stuff. Next one is that this is systems which I developed in IIT Kharagpur in microelectronics lab. It is an artificial lung, but 27 diseases is unmanageable for me to develop in this lab. We make 4 diseases. So you can think of 4 chambers where precisely we can control the flow of those VOCs through external means and make the mixtures, then train the sensor is on this probe, and where you know that I can generate different percentage of those VOCs and their combinations and expose the sample with that, so I can have the response of that. So you can take it that I can train my neural net and our AI platform by those synthetic data. So I can produce lakhs of such data using that experiment. So that is the first step towards it, making and design an artificial lung which can cater for or emulate the 4 diseases that I mentioned, and then fine-tune that one with, how can I fine-tune that one with, actually this is, so the video is not working. So this is a Taylor bag. We go normally to the patient and take the data from the hospitals. And here we take the data from Calcutta Medical College and North Bengal Medical College. 50%, we go to the nephrology divisions and 50 sample data we take at one go, and then we analyze the data to fine tune the training model so that we can predict those 2 VOCs and to decide whether you have got the how it functions, your kidney or liver or something. It's hang করে যাচ্ছে। Can anybody help me? The video is there, but you can skip that one. Yeah, so it is showing here, but it's not showing there. And most of my presentation is through videos, and so I quickly go. Yeah, so you can see that while I'm exposing this with these VOCs, then there is a drop in the current. And that drop in the current is in the nano ampere range. And that drop is the indications of the presence of this particular gas. So you can say that it can actually, that change in the current can go for any kind of gases. True. Also there are the vapor, water vapor, and carbon dioxide and oxygen, so much. So what we have done, that we have making a 3-terminal device where we are changing the gate voltage, and we have found out that for a particular gate voltage, there is a particular gas or VOC is having the highest sensitivity of that. So I can separate out for that. 2 approaches is made for the selectivity. One is functionalize the channel with some molecules, and also with the changing the gate bias. So this gives us the better sensitivity and the higher selectivity. So like that. So these are, I'm quickly doing it. These are the interdigitized structures. These are all fate sensing, and where we are making that, we are using 2D nanomaterials for making the device, either not the RGO exactly, but we have doped with something, and also MOS2. And looking at its various process, we have actually make the device. And finally, we see that how actually with the exposure of, say, particular gas, say ammonia, then it goes back, it drops on the current and goes back to the background. So that is important, whether it goes to its steady state value or not, the background value. So drop in delta I, that is a measure of this sensors. Anyway, so this will go. We are using graphene, MOS2, and many other kind of functional materials on the top of the channel. Now coming into this kind of signatures will come. Now that is the biggest problem, that where multiple gases that VOC is coming, and they actually, where it changes the spectrum, somebody talked about the feature extractions, then actually main problem now here to take the decision making where we take the help of the AI. So AI has to be trained in such a way that they can actually check the meta features, and from there they will be able to quantify. So there are two approaches. One is semi-quantitative, other one is the qualitative estimations. So sometimes just qualitative, just like a screening test. Sometimes we like to know quantitative estimations. So there we take the advantage of AI platform. And how we make that AI platform ready with that is that we make synthetic data first with the artificial lung, and then we actually go for actual patient data. And then from there we fine tune this and to make this training of the network so that we can finally predict that what kind of, finally we'll get that what kind of diseases are responsible for those features. So those are the, and this is the approach what we are planning, that it will be an SOC kind of a stuff where the CMOS platform will be to all the electronic interfacing and very low noise, signal to noise ratios, and the top of that will be the sensors, which will be the source and drain, and the gate will be opened as you have seen that one, and that will be functionalized. So idea is to make it in one monolithic circuits. So it is called SOC, and then we can actually make that. So what I said, that now a sensor systems, the definition has been changed. Now sensor interfacing electronics and the readout circuit, that was say 5 years before. Now that ROC, after that there is one stage called decision block, which is the AI platform. So whole sensor invention or innovations have gone into that phase, taking the advantage of AI. So you understand that after the electronic interfacing, the next phase is the decision making block. So this is actually, can I run that? Yeah. So this is actually, it is the, it's coming? Yeah. So this is a documentary of that. With the sound has come. Sound. Where sound?
In the Department of Electronics and
It's a
Electrical
5 minutes
Communication
document
Engineering,
to
research
summarize
in
all this in a real
microelectronics, sensing,
state.
and artificial intelligence is being translated
So
into
this is the
practical
artificial lung.
solutions for real-world healthcare challenges. In the Microelectronics and MEMS laboratory, under the guidance of Prof. Tarun Kanti Bhattacharya, a team of researchers, Dr. Santana Majumdar, Dr. Avik Seth, Dr. Lisa Sarkar, along with Mayank Kohli, Dev Linakar, and Garrick Karmakar, set out with a clear vision to enable early disease detection through a simple, rapid, and completely non-invasive method. The inspiration came from a powerful observation. Human breath contains valuable information about our metabolic health. Each breath carries trace amounts of volatile organic compounds or VOCs whose concentration changes in
So
conditions
this is
such
our
as chronic
device.
kidney
I will
disease,
come into details of
diabetes,
that
and other
inside.
metabolic disorders. To make this technology clinically relevant, breath samples are collected from patients in collaboration with medical
So
colleges
there my
and
students are
hospitals.
going and take
The
the
samples
data,
are collected using
of
medical
course with
grade
the
Tedlar
ethical
bags,
clearance and
ensuring
everything.
preservation of trace gases without
So this is the Tedlar
contamination
bag.
while maintaining strict
We
ethical
actually ask
compliance and
the,
patient
this is the nephrology
confidentiality.
department, that the
These
patient
samples
is
are
having
analyzed
CKD,
using a
the
silicon-based field effect
likelihood
transistor
it
sensor
is.
array. When VOC molecules interact with the sensing surface, they modulate the electrical characteristics of the device, generating time-dependent current signals. Each experiment is performed multiple times under controlled operating conditions to ensure reliability and reproducibility. This results in a comprehensive time series dataset representing real patient breath signatures. Since raw sensor signals are non-linear and affected by noise and environmental variations, advanced signal processing techniques are used to preserve critical response features. From the filtered data, statistical and temporal features are extracted to capture the dynamic behavior of the breath response. These features are then analyzed using machine learning and deep learning models. A bidirectional LSTM architecture is used to capture temporal dependencies in the sensor response, while reinforcement learning is applied to optimize model parameters and improve generalization with limited clinical data. This AI layer transforms raw electrical signals into clinically meaningful diagnostic insights. To translate this capability into
This is a
real-world
device.
deployment, the system is being implemented as a compact
So,
handheld device. The device integrates the
so
sensor
this is the
module,
removable
low-noise
portion,
analog
and
front-end,
you have seen
embedded
that we can
processing,
open the
and
device,
edge AI
and
inference.
just like after
The
10
user
uses,
simply
you will
exhales
change
into a
the
disposable
strip for
mouthpiece, and
glucometer.
within
Like
seconds,
that, you
the
will change
system
the
provides a
strip,
health
the
indication.
sensor,
The
and then
electronics
you
and
can
system
change this part
architecture have been
lower,
optimized for
so that
scalability
you
and
can, and this
manufacturing.
cost, the
The
BOM
total
cost
bill
is
of
around
materials for
2000
the device
rupees.
is targeted at
And
approximately 2000 rupees,
yeah,
enabling a manufacturing cost below $25. This cost advantage makes the technology suitable for large-scale deployment in primary healthcare centers, community screening programs, and home monitoring applications. The project is being developed in collaboration with AI for ICPS.
so this is actually the program which is being sponsored by AI for ICPS in IIT Kharagpur, and we are thankful to them for funding. Next one, I quickly go to the our other innovations where require AI is called mass immunization program. We have developed a vaccine patch which is not uh, uh, painful, just like, and also temperature. Uh, they are thermally stable. You don't need any kind of a temperature or cold chain systems, and that is for it is just an applicator. We just push this to the drug where we require AI, because you know that when they are, suppose one customer they want this is the thing, that the protein molecules, that the vaccine molecules and the whole polymer matrix, so they are actually conjugated in such a way that because of the change in temperature, that should not denature my protein structure to get it temperature stability, so that even at 42 to 52 degrees centigrades, you do not need, your vaccine is not getting denatured or inefficient. So exactly that is the physics behind it. Now you know that this is has been done for few vaccination. Now government has declared this as India map, and that will be in 2030 of the WHO one, that this will be the platform, transgender patch platform for mass immunization, especially for kids. You know that for 6 to 9 years, 6 months to 9 years old, this very traumatic for going a thermal for a transdermal or hypodermic syringe. But this kind of patch would will be very simple and not so expensive, and I can send it by post to the parents, and they can actually administer that one. So we have gone up to 40, but this fellow actually, that he called me, and he is interested about to develop it for the Ebola and the measles virus. So we are doing it now. Now AI, why I require, because this gentleman asked that how I am doing it for hepatitis B and flu virus. How much time you will take to make for next 1 year? We want for Ebola and measles for the African country, that too at 52 degrees centigrades. So what will be my polymer and functional materials and those vaccine, and that integration of that requires, this is the requirement of AI at this moment. So that molecular dynamics and the vibrational modes of vibrations, those will be now has to be fed into a trained AI model, and how quickly I can generate that polymer molecular structures, so that I can integrate with that particular vaccine, okay, and then we can actually quickly develop a thermally stabilized vaccine development plan using just a patch, okay. So two of the basic major pharmaceutical company have already signed agreement with us, and that is for different. So it is for different vaccinations. So now really I require the AI in a platform because I have to deliver this one in a very quick, within 1 year time, we have to develop that one for different vaccination programs. So we have our own research park at Rajarhat complex, and where we have making our GMP facility. So that's a spin-off from my lab. Is called Innovodyne Private Limited. We have got the funding from the various investor and venture capitalists. We are also looking for that, and also Bill Gates Foundations will ready to give us money. Last line, this is the ... things that we are not only working on the artificial intelligence, we are also working on the intelligence itself. We developed a molecule in collaborations with Japan, the NIMS, which is a nanobot, okay, and which has get own transmitters, sensors, antenna, and so on, and which can be trained, okay. So I'm quickly going to the next slide. So it is that it can, if in a maze problem, suppose you have a complex path, then we have given in the task that you go from point A to point B. So essentially, if you look at here, that suppose I inject that molecules here, then it has got the intelligence to find the shortest path to go to the point B. So that is the intelligence we find in the molecule itself, PCMS we call it, which is developed in collaboration with NIMS Japan and Arizona State Universities. And that is the finally what we are doing. We are trying with cancer drug, we find cancer cell, and here the PCMS, now it has got its own intelligence, it can go to that cancer, and if that cell is not non-cancerous, it will not move at all. So this viewgraph will prove that. You will find this, if I turn there is a 14 hours experiments, it has got the intelligence. Now we are looking for that from where the intelligence comes, the molecules. It can actually know that there is a cancerous cell, so they will actually go towards cancerous cell, solving that problem to the least path that will go. And that is, and if you don't have normal cell, they will not at all move at all. So this is, we call it the intelligence in the molecular intelligence or natural intelligence. So can we go for the artificial brain? That's the big innovations. But I am restricted for my drug delivery. So we'll use that one. The PCMS molecules will have the drug, and so that selectively they can go to the cell and annihilate that one. So that is from transitions from AI and now from the actual intelligence and how it can propagate. This is an ongoing work, and which is being sponsored by Spark, and all these experiments has been actually done in our lab to prove it. And Dr. Stewart, who is actually, Penrose and Stewart, they are colleague each others. So, so their ideas, now we are actually experimental evidence of that. So you can find this green path, how it is finding the path to reach to a cancerous cell, where if not a cancerous cell, it will not move at all. Okay. So with this, I like to stop and thank you if you have any questions.